Sydney works with Wavelength through the Australian Institute of Health Executives and has a very illustrious career within medicine and in leadership. And I'm very pleased that she's agreed to join us today and talk a little bit more about that. Women now make up more than half of the Australian medical graduates, yet represent only 45% of senior medical practitioners and just 36% of specialists, and then are represented even in smaller numbers in sort of leadership and clinical leadership. So those are some of the things I think that we'll reflect on when we talk today. First, Sydney, I wanted to perhaps ask you to share some of your personal journey in terms of initially getting into medicine and then the move into leadership roles. And what do you think are the defining moments in your career that have shaped you as a leader?
Hi, everyone. Thank you so much for inviting me to this forum. It's great to meet all of you. I started out in medicine not really having any intention of going into leadership. So it was very much a career that was targeted towards clinical medicine. I even signed up for the College of Physicians training program and then pulled out a week later. And the situation there was that whilst I was practicing as an intern and a resident, what I found was there were so many systemic and operational decisions at the health level that impacted patients, across the board, not just when you're a clinician treating one patient at a time. And I know it sounds really cliche, but a calling towards that because I wanted to impact health systems on a larger scale and a lot more than just that one-on-one clinical interaction. So I pursued management and ended up doing training in that. And as a result, really got to experience the healthcare leadership scene across both public and private contexts in Australia. And I've actually been lucky enough to have worked in now 5 jurisdictions in Australia. And that has given me a lot of perspective because let me tell you, every jurisdiction is different, particularly in terms of how they deal with, these issues that we're talking about today as well. So I guess the defining moment in terms of leadership is really going into that leadership space and realizing that this is, it's not just about doing the task or being efficient or being smart enough or coming up with the answers. It was really about learning how to influence and understanding how the existing culture and the governance structures and funding structures and the politics of an organization really shapes how we provide care, but also to what extent leaders can have an influence, and particularly female leaders. Now, when I went into this leadership side, it was called the dark side by my clinical colleagues at the time. I was of the understanding that, it would be quite straightforward. And the thing is, I was quite junior when I went into it. I had only done 3 years of clinical medicine. I hadn't specialized as a consultant. And so I had that, apart from being a woman of color, if you will, I was also very young in age compared to the other clinicians that supposedly had to manage. So that really gave me perspective in terms of another barrier or another inequity, if you will, to women who go into these type of roles. Because when you're perceived as young or inexperienced, there's a whole different level of, bias and barriers and challenges that you've got to get through from that one-on-one interaction with people.
How do you counter that then? If you're seeing that potentially there is cynicism or skepticism, whether that's related to your age or being female, how do you handle that?
I think, look, to be honest, and I know that this is not something that I will be proud to say, but you do have to have a bit of thick skin in a way. You can't take these things personally. And I think you've got to understand that this is the culture that is long-standing. And it's great that we're doing everything we're doing to even the playing field. But the reality is that it still exists on the ground. And when you go into this field, you've got to be aware and really prepared to deal with that. I guess the way that I dealt with it was I tried not to take it personally and really just sort of proved myself in terms of actually doing the work and actually building those relationships and making a difference and following through on action. So I think at the end of the day, those fundamental things that you do as a leader, what you achieve really does speak out in terms of, who you are. That kind of overshadows all of those other aspects or biases that people may have towards you. And, eventually people then, I guess, see what you're about, and some, revise their opinions, others don't. That was sort of the way that I kind of just trudged through it, I suppose.
Yeah. So that was your personal perspective. From a system perspective, what do you think remains most out of balance, I suppose, in the context of healthcare leadership? And What systemic changes do you think can be made to support more women into leadership roles?
I think that what really remains off balance is the good intentions versus the actual structural and cultural change that we keep talking about or intending towards. Every International Women's Day, and I recall this last year as well, we're talking the same rhetoric. It's the same intentions, it's the same, which is great. But when do we start making actual real world progress and actual structural change? That is the imbalance that we have. Whilst we are changing people's thinking and awareness around this topic and collating all of those intentions towards achieving equity and sponsoring women into roles and supporting women in leadership, I think there's still a huge gap in terms of how that actually looks in the real world and how that actually works once they're in those roles.
Have you worked for any organisations that you think are doing it well from a structural perspective?
Not from an organizational perspective, but from an individual perspective or individual role perspective within the organizations, yes. What I mean by that is that I haven't come across an organization that is mature enough or has evolved enough to be at the level where that imbalance doesn't exist. Unfortunately, not yet. But I have come across individuals within those organizations who absolutely do. And I think they're the ones that really help to balance those scales. And I'm talking about individuals, by way of your line managers or your team leaders or whatever role they have in terms of the interaction they have with you in that team. Their behavior and their rhetoric or their advocacy for you, I've seen how that can really open doors and how that can really sort of impact someone's career, as well as the opposite side of it too. I've seen how that can really hinder female clinicians' careers as well. And it's interesting because I know we say that, men need to be more supportive of women, et cetera, in terms of women in equity in leadership. But what I've actually found is that men actually are quite supportive. We tend to have this group of, I guess, senior women who I understand would have come through, all of those challenges that sometimes may perceive it even as a threat still because those structures aren't embedded yet. So I find that there are those roles and those individuals that unfortunately does not support to balance those skills as much as some of their male counterparts do. But having said that, there is always that element of bias and, preconceived ideas from both sides when it comes to women in leadership roles.
Sure, thank you. In terms of the current landscape in Australia, and, we hear about clinical workforce shortage, and as I mentioned earlier, some of the studies around numbers of women that go into medicine, but then slowly sort of drop off through their career for various reasons. So what role do you think gender equity plays in perhaps that broader conversation about workforce sustainability, and what changes should we be making to try and retain women in the clinical workforce?
I think that retention in the clinical workforce is a widespread issue regardless of gender and context, but particularly from the gender perspective, flexibility in terms of the roles, in terms of working arrangements, in terms of return to work after, parenthood, for example, or short leave period. All of those things play a much stronger role when it comes to retaining women in healthcare roles. And I think that we really need to think outside the box and outside of those traditional workings of how we currently function. And especially from a HR perspective, not your 9 to 5, Monday to Friday, rigid structured weekday. We've got to be more flexible than that, and we've actually got to think a little bit outside the box. And to be honest, I think COVID has helped that with the advent of telehealth and the uptake of that. I'm finding that there's a lot more flexibility, and there's more scope to grow in that space. But flexibility in terms of the work arrangements and the types of roles and the level of input women can have into those roles, I think is very important, as is also the opportunities they have for leadership positions. I'll give you an example. In one of my previous roles as an executive director of medical services, when I went into the organization, the entire clinical director team or structure was about 85% male, and this is Caucasian middle-aged male. And there were very talented, very, intelligent female clinical leaders in those specialties. But I guess that what I saw was that nobody had actually tapped them on the shoulder or told them, hey, I think that you could do this. You should put your hand up for the next deputy director role, or step up to do an acting leave cover for the clinical director, for example. So one of the things that I'm actually really proud of that I did, I think it was only last year, was I started talking one-on-one to one of the young surgeons, female surgeons in that health service. And it's the same story I got, thought she was too young, too inexperienced, just absolutely not to the caliber of the other clinical leaders. But with that sort of one-on-one mentoring and support and advocacy, I was able to sponsor her into a deputy director role. And within 8 months, and of her own merit, she went through an interview process and is now appointed the clinical director of that entire specialty. The youngest ever female, I think they've ever, first female they've ever had, but also the youngest they've ever had. That really tells me that, unfortunately, that system is not mature enough to make that happen. Us as individuals within the system have to make that happen until it gets embedded within the system. So I think that it's an important role for leaders and for everyone in the current healthcare space to actively advocate for, mentor, sponsor, tap on the shoulder and offer opportunities based on merit, never based on the fact that just because they're a female, they're going to be put into leadership positions, but it does have to be based on merit. But keeping in mind that to close that gap, we really do need to support that, because we're talking decades of entrenched cultural, legacy systems where many women believe that they are either not ready, not experienced, or not good enough to take up leadership roles in healthcare.
Thank you. So your individual actions in that example obviously had a big impact on that individual. So if there are more actions like that around the system, then we should see change. But I suppose there's a role presumably to play with the specialist training colleges, with the health sector itself, at an organisational level. Is anything happening? You're a part of RACMA. Is there anything happening at the college level to try and drive change?
So just going back, sorry, before I answer that question, Claire, just going back to that example, it's not just the specialty colleges, it's even the leadership structure within that particular organisation that can be not a barrier, but a challenge. Because in that process, I was questioned as to, do I know what I'm doing? Why am I promoting such a young person who's inexperienced, et cetera, et cetera? So there were multiple barriers that were thrown in. So I think, even within that internal leadership structure, there's a lot of barriers that still exist for that. And then going to your question, in terms of the medical training and the specialty colleges, yes, I think that there's a lot that can be done. My feel is that we're still at the awareness and, good intentions phase of change, which is necessary. But there are, we need to have very transparent pathways, for example, for allowing access to women into specialty training programs, and opportunities for them to progress through it in a flexible way that takes into account the various demands, etc. And also, in terms of the assessment, to methods or ways of how we can reduce bias in those assessments, or inherent bias that sometimes creeps in. And then again, even with the colleges and training pathways, I think the sponsorship, the inclusive leadership and exposure to leadership opportunities and supporting women or trainees into those positions are really important. And at RACMA, we have started a special interest group, which it's relatively new. It started last year, and for advancing women in leadership. And what that does is it puts a focus particularly on this issue within the college and from a medical administrative lens. And I chair that group. And, I still find that it's great to have those structures. But again, this is all this all needs to translate into actual structural change. And that means changes in governance structures, changes in resourcing, changes in funding frameworks, changes in the politics of an organization, and most importantly, changes in the culture of an organization. So I think it's a really long way to go, but I think I'm encouraged that, there are programs such as that does place a focus on the issue, at least for now, so that people can speak up about it. Because at those meetings, I find, it's very common that women in other leadership roles often, are experiencing the same type of challenges, and they don't have an avenue or a forum to really raise those and discuss those, and I guess find peer-supported responses to those, or how to manage those. So those sorts of forums really help. And I know that Rackman's also part of or partnered with the Monash University in terms of doing research into advancing women in health leadership. Some of that was published last year. So there's a lot of work that is happening in that space.
Yeah, thank you. What is a practical piece of advice that you can offer any woman that's looking to perhaps achieve what you have achieved in leadership roles, whether that be somebody that's a clinician or not? Is there any particular pieces of advice that you would offer someone that aspires to be a leader?
Yeah, I think reflecting on my sort of beginnings, I viewed leadership as this, idealistic, high standards setting. And I had to really adjust to the reality of the situation and the challenges that I didn't think existed at the time. So my advice would be to really understand the practicalities and the current state or level of maturity where we're at in terms of gender equity, particularly in healthcare, and particularly in healthcare leadership, before when you go into those situations, because you've got to, as much as advancing your leadership skills, you've got to understand the organization, how the networks, work, how the politics influence the culture of the organization, how the decision making actually happens, not what's written in governance documents and rule books. So I think learning those sort of roundabout things that are quite practical and on the ground really helps someone, rather than going into it with sort of, with this, this structured, or thinking that, things just happen in a certain way that as they're written down. So I think at the end of the day, it's about the relationships that you build with the people that you work with, and who will advocate for you and who will sponsor you and support you when you're not in the room. I think that is the practicalities that we've got to really get, pass on to people who come into this field.
Thank you. And then finally, if we were having a conversation reflecting on gender equity in the clinical workforce, say in 5 years' time, what changes would you hope that we'd be celebrating?
Well, I think that, I'm hoping we celebrate sector where we are no longer at the good intentions and rhetoric phase, and where we are actually have structural change embedded, we have fair processes, we have transparency, and that equity is not an afterthought, or gender equity is not just an afterthought, that it's actually baked into the system that we run, and that women are equally represented in executive teams, in boards, even in clinical teams or clinical leadership teams. And I think that I hope to see leadership pathways that are quite flexible and open-minded, that allow diverse voices to really shape the decisions that are being made. And the other biggest thing I would hope, and hopefully this is too much to hope for in 5 years' time, but in terms of the pay gaps and the disparity between, promotions and those structures, I think hopefully we will be at a place where those are more equitable.
Okay, thank you.